Hey, this is Dr. Jason Barker with the Natural Athletes Clinic, and today I want to talk to you about joint pain. So there are two major causes of joint pain. One is rheumatoid arthritis, which is an autoimmune condition where your immune system attacks the joints, causes redness, inflammation, a lot of pain. That's tested in the blood, and that'll tell you if you have rheumatoid arthritis. And then the other main kind of arthritis is osteoarthritis. And this is just simply a wear and tear type of arthritis where the cartilage and the connective tissue inside of your joint starts to wear out. Now, why does your cartilage wear out in your joints? Is it from running too much? No. Is it from using your body too much? No. Okay, lots and lots of people, especially the people who don't run very much, will love to tell you that, oh, you're running and you're going to wear out your joints. Well, I'm here to tell you that simply is not true. Okay, using your body does not wear out the joints. Whose joints wear out first? Runners or sedentary people? Couch potatoes. The couch potatoes, their joints wear out first. We need that up and down motion. We need some of that shock absorption. The joints need that stress on them to actually stay healthy. So this has been studied over and over and over again. People who are active have healthier joints than people who are inactive. Okay, so remember that next time somebody tells you, oh, you're gonna wear your joints out. Okay, it isn't true. So what can we do to help relieve joint pain? Well, the wrong answer is taking Aleve or ibuprofen or Motrin, any of these drugs that go in the NSAID category, non-steroidal anti-inflammatory drugs. Okay, these things are bad news. Unfortunately, we're all told to pop one of these things or pop them several times a day if you've got any kind of pain. Well, that's a bad idea. There's two dirty little secrets with these NSAID type of drugs, and one of them is that they actually inhibit joint repair. They inhibit the healing and the repair of cartilage, which lines the joints, which is the shock absorbing material. They stop that from happening. The other problem with NSAIDs is they cause gastrointestinal bleeding. They make your stomach bleed when you take too many of these things. Guess how many people die in this country every year from GI-related blood loss from NSAIDs? It's about 20,000 people just from taking an over-the-counter medication. So in my book, these are not very safe. I would avoid them as much as you can. Take them very, very infrequently. Okay, so the good thing about natural medicines, though, is there are many of them, and we can help make the joints, we can protect the joints with them, and then we can also decrease the inflammation and pain with them. So there's a whole handful of natural medicines that we can use. Most important one is probably glucosamine sulfate. By now you've heard of glucosamine. It's a type of protein that helps you build the proteins that your cartilage is made out of. So glucosamine is actually the only thing we've got that helps rebuild cartilage. It also has a slight anti-inflammatory effect and slows down joint aging in that cartilage. So it's an important medicine to be taking if you have joints. And of course, everybody has joints, so I recommend everybody take some glucosamine. Now, studies with glucosamine are very interesting. Many people can end up taking it for a few weeks and they'll feel as much pain relief in their joints as they would have if they'd taken an ibuprofen every day. So of course, we don't want you taking a bunch of ibuprofen because of the problems I just talked about. So think about taking glucosamine if you're not. You also need several micronutrients to help that cartilage regenerate and grow. Things like manganese, zinc, copper, and vitamin C all act as cofactors in cartilage repair. Now, these are pretty commonly found in many joint supportive nutrients. They're also found in a good multivitamin. So make sure you're getting those in your supplement regimen if you're not. And then what do we do for pain and inflammation in these joints? Don't take NSAIDs, okay? I don't want to keep hitting that one over the head. That's really important. We can take some natural medicines. We can use things like boswellia, which is actually frankincense from the Indian subcontinent. We also have another great herb, curcumin, which is derived from turmeric, also a spice more commonly found over in India. By the way, you want to get a better type of curcumin that's attached to something called phosphatidylcholine, because regular old curcumin or regular old turmeric is very poorly absorbed in the gut. So you need to look for a special type that is a lot better absorbed. You'll get way better effect from that. We also use things like bromelain, which is a proteolytic enzyme derived from pineapple. Okay, that can decrease a lot of that inflammation in there. Devil's claw is another important herb, also a great anti-inflammatory. And so there's a lot of different ways that you can decrease this inflammation and this joint pain, and also at the same time help those joints recover and repair themselves. Okay, so take a look at some of these items. We've got a lot of information on the website about them. If you're a runner or you're any other type of athlete, this is really important. We want those joints to be healthy. Of course, they take a lot of that stress, and adding some of these nutrients into your regimen can really help decrease that pain, decrease the inflammation, and prolong the life of your joints. All right, thanks for watching, and we'll see you guys again soon.